morning. I'm Jill Woody, Director of the Alexander Senior Center. Want to invite everybody down to the Senior Health Fair. We hold it every October here at the Alexander Senior Center. We have lots going on. We give the flu shots, pneumonia shots. They're doing cholesterol testing, the metabolic panel testing. We also have glucose and earwax, vision testing, glaucoma testing, blood pressure, and lots of other stuff. So come on down and let's go in and see what's happening. Hi, Judy. We're so glad you're here today helping us at the health fair. Do you want to tell them a little bit about what you're doing?
Yes, I'm registering people as they come in and giving them door prize tickets. That way we can count everybody that comes to join us. We also make sure that if you want a flu shot, that you get the paperwork filled out, and we send you back if you want a metabolic test. And I'm glad to be here. This is something I've done for about 6 years, so I'm glad to help.
Hi, Mary. I know you're with the Area Agency on Aging, and tell us a little bit about what's happening here today for you for the health fair.
Yes, I'm the family caregiver specialist with it, and I'm representing the Area Agency on Aging today, Jill. And we're just excited to be here at the health fair. It looks like it's a great turnout. It's a beautiful day. I think everyone's having a great time today. One thing I'm making sure I let everyone know about, we have the highlights from the Senior Games, the 2012 Senior Games, and want to make sure that everybody stops by today to pick up that information from us, to enjoy looking back on the year with that. But it looks like it's just a great fair. Everything seems to be going wonderful. We're glad to be here.
We're so glad to have you. Thanks for coming, Mary.
Thank you.
And here we are with Sharon Cox from CVCC here in Alexander County. Sharon, how's it going for you today here at the fair?
Oh, it's going marvelous. This is a great turnout you're having. Hopefully we can get some more classes going at CVCC and get some seniors involved in it.
Thanks so much for coming.
You're welcome. Thank you for inviting us.
Yes, and Christine Gates is our new assistant director here at the Senior Center. I want to welcome her today. She's here manning our SHIP booth, which we're doing. So Christine, tell them a little bit about SHIP.
SHIP is a state program, and it helps seniors with their insurance and Medicare supplement plans. And right now, during open enrollment, we have these purple sheets that the seniors can come in and fill out, and it lists their drugs back here. And we do a plan comparison with all 30 plans across the state so that we can try and assess what's the least expensive for them for the drugs that they take specifically. So come in and get your purple sheets and fill them out.
And they need to get in here and get those done because enrollment ends December the 7th and everything has to be completed by then. So come on in and get your plan now. I'm standing here with Alexander Funeral Home. We have a couple of nice ladies that have come, Alicia and Amy Fox. And Alicia's going to tell us a little bit about the new grief support system that they have in place over at Alexander Funeral Home.
Yes, we've started a brief grief support group for those that have lost loved ones and are dealing with grief, and it's a 13-week Bible study to help you with your loss and being able to deal with that loss and your grief or whatever you're dealing with. So that is a 13-week Bible study, and it's at 9 o'clock on Thursday mornings at Alexander Funeral Home.
And can they just drop in for that, Alicia?
Yes.
They don't have to call and register?
No. But it is a 13-week commitment for a 13-week Bible study.
And Carolyn?
Amy.
Amy, I'm sorry.
That's okay. That's okay.
Do you want to tell us a little bit about how's it going this morning?
It's going wonderful. There's a lot of interest, and it's just really exciting to be here.
Good. We're glad to have both of you here.
Yeah,
Thank you so much for coming.
Thank you
for having us.
And here we have Mary Leslie Yunt. She's from Beata Home Health. We're pleased to have you. This is the first year you're here with us, isn't it?
It is. Thank you very much for letting us be here. It's been a great event today. We've had a great turnout. We're here just to talk about our services that we offer to pediatrics as well as adults and seniors. We provide home care. Our home care is assisted type care, personal care in the home, as well as skilled care, where we provide nurses for folks who may have more serious health conditions like ALS, trachs and vents. So we pretty much cover the gamut.
Well, we're certainly glad to have you here.
Thank you.
We hope to see you next year.
We'll be here.
All right, thanks. Yes, and here we have Donna from Carolina Orthopedic. We're really glad to have you today, Donna. Tell us a little bit how it's going this morning.
Well, it's going great. We're glad to be here. We just thank the Lord for the people that's come out. Dr. Slatica is here with Carolina Orthopedics in Taylorsville, Monday, Wednesday, Friday. We also have 6 locations in Newton, Taylorsville, Valdez, Mountain View, and Lenoir, and Boone now. We recently opened a Boone office. So just come out and let Dr. Slatica be glad to take care of you, and we're just glad to be here at the health fair.
Well, thank you so much for coming.
Thank you.
Hi, we're here with Michelle Fisher from Pace at Home. That's a new program. You've only been around for about a year or so now, haven't you?
Yes, since February of this year.
You want to tell us a little bit about Pace at Home?
Sure. We're programs of all-inclusive care for the elderly. We're looking for patients that are dual eligible with Medicare and Medicaid, age 55 years old and older. And we're all-inclusive. We do everything from, we have a day facility where they can come Monday through Friday, 8 to 5. We offer transportation to and from. We are in charge of all of their medical care and for the participants 24/7. So we have a doctor on staff, nurse, social worker, therapist where they can do their therapy at the facility. We offer 2 snacks and a lunch while they're there, and we also have a activities coordinator that's there Monday through Friday also. And then if they have any other medical needs outside of our facility, we would also coordinate that transportation as well.
Well, we're certainly glad to have you here at the health fair with us this year.
Thank you. I appreciate you having us.
We'll look forward to seeing you next year.
Okay, thank you.
Hi, Jeannie. This is Jeannie Little with Best Value Hearing out of Statesville. We're certainly glad to have you here at the health fair today. You want to tell us a little bit about what you do?
Yes, I come to the health or to the center about 3 times a month on Wednesdays, do free hearing tests, cleaning for hearing aids, adjustments, and that kind of thing. And I've been coming for probably about 20 years. And today what we're doing at the health fair is looking in people's ears to show them their eardrum. So they're basically seeing sort of what a doctor sees, that we're checking for earwax, and if they're impacted and stuff, and telling them that they need to go and get it taken out.
Would you mind if we watched you do a test?
Well, what we're doing, yes, to look in the ear would be great. So she's going to see actually here as we go in. Back there's her eardrum. She does have a little bit of wax in there, but she's not blocked. All right, let's go on this side. That's all right. And on this side, she's got a little bit of wax around the edge. Wax has a bitter taste and smell, and it keeps insects from wanting to climb in your ears, but having too much can impact hearing up to 40 decibels, so you don't want to let it get impacted.
Okay, well, we certainly appreciate all that you do here for the center, Jeannie. You're so welcome. Everybody looks forward to you coming. And we do sell the hearing aid batteries here at the center if anyone needs hearing aid batteries. Here we have Chapman Funeral Home. You want to tell us a little bit about what you're discussing with people today?
Yes, ma'am. This is Bill Randlett. I represent Chapman Funeral Home. Been with them for 10 years. And we're giving away fans and pens and calendars for the new year. And that's the fishing calendar, the sports calendar, the almanac calendar, one you can't find too often. Anyway, we've been talking about any services that we can assist anyone with, from pre-need services to serving a family once a person has passed away, and try to do our services the best we can to anyone that needs assistance in a time of need.
Well, we thank you so much for coming.
Thank you.
And here we have Mark Bumgarner. He's from Adult Life Programs. Mark, we're glad to have you here. You want to tell the folks a little bit about Adult Life Programs?
Sure, Jill. Thank you. Adult Life Programs is actually a nonprofit provider of adult daycare services. And most folks don't realize this, but we were actually founded in 1983. So next year we'll have been serving folks for 30 years. We have a program in Hickory, Conover, Lenoir, and Maiden. Our Hickory Center serves Alexander County residents, as does our Conover Center. And historically, we had a center here in Alexander County at one time as well. We are able to serve a variety of different folks with different needs, and we're very proud of that. Our Conover Center, for example, serves folks with chronic mental illness. Our Hickory Center serves folks with debilitating physical needs and can handle care up to wound care, IV care, and brittle diabetic care. All of our programs feature activities that are based in the community. We believe it's very important for people to remain in the community and be a part of that. So we're very happy to be here. We're thrilled that we can serve Alexander County. We're just really happy to be here, I guess.
We're glad to have you. Thanks
Thank you
so much for all that you do. Yes, and here we have Chris Bowman with the Alexander County Sheriff's Department. Chris, I hope you're not here arresting anybody today.
No, not today. Today's a freebie.
Good. Tell us a little bit about what you're doing here.
Well, myself and Lieutenant Moore and Sergeant Moose is here, and we're showing off. It's a new program called Project Lifesavers, and the program here is for individuals that may have Alzheimer's or habit of walking off from home in the past. And this program here is set up where a bracelet is put on the individual, and if they ever walk off during the night, during the day, whatever, then our team is sent out to locate the person. And so far the longest has taken any person be located is less than 30 minutes.
Oh, that sounds like a great program. Now, is there a cost associated with that?
There is a $25 monthly cost, and it's not to make money for the sheriff's office or the county, but that helps to replace the batteries that goes into the bracelets for the individuals.
Sounds great. Anything else? I see you got
Well,
others.
we do. We have this. It's called Are You OK program. This is a program that's set up through the computer at our office. That if elderly person needs to be checked on every day, that they give us the information. We put it in the computer, and it automatically calls and the phone for them to pick up to see if they're okay. Okay. And then the last, not least, is a community watch program that we have started in the last couple of years here in the county, and it's working real well. And anyone that's interested in any of these three programs that we have is welcome to contact Lieutenant Moore and Sergeant Moose.
Okay, and we appreciate you coming so much.
Well, thank you for the invitation.
All that you guys do for us in Alexander County, we really appreciate it.
Thank you.
Thank you. Hi, I'm here with Libby from Iredell Eye. We're glad to have you here today, and tell us a little bit about what you're doing here.
All right, we're, like I say, Iredell Eye Center, and we're a part of Charlotte Eye, Ear, Nose, and Throat Associates. We do ophthalmology in our office. We have 3 comprehensive eye doctors, Dr. Holland, Dr. Warren, and Dr. Self. We also have specialists come to our office. We have Dr. Andrew Antoshik, who takes care of our retina issues and treats diabetic retinopathy in the eye. We also have a glaucoma specialist, Dr. Robert Saltzman. And then we have a pediatric ophthalmologist now coming to Statesville, which is great because we don't have a local ophthalmologist for pediatrics. So she's taking care of our children now. We're excited to have her as part of our office. But we've been in Statesville since 1982.
Well, we're certainly glad to have you here today at the health fair. You come every year, and we so appreciate all that you do for us.
Glad we could come.
Thank you. And here we have Sandy Austin from Dudleys Home Health. Sandy, we're really glad to have you here today. Tell us a little bit about what you do here at the Senior Center.
Okay, I'm glad to be here. Actually, we come and do bingo, help out where they need it as much as possible. Dudley's has been in business for 20 years, and we've got different programs that we do, and we love being here, and it's a blessing. It feels like family here, and we're very appreciative of letting us come out at all times. Thank you so much.
And I understand you're going to be doing a fall prevention class for us coming January.
Yes, ma'am. Yes, ma'am. These different classes that we do teach are chronic disease, living healthy with diabetes, and also the matter of balance. So anytime we can help, that's what we're here for.
Well, we're looking forward to it. Thank you so much. And if anybody's interested in the fall prevention class, let us know here at the center. Yes, hi, we're here with Bob from Pinecrest Retirement Community. We're really glad to have you this year. This is the first year I understand that you're taking part in the health fair.
It's actually the first for me, but we were here last year as well. Mm-hmm. Yeah.
Tell us a little bit about how it's been this morning, and tell us a little bit about Pinecrest.
Well, it's been nice and steady this morning. We've had a good number of seniors coming through, getting information and asking questions, and a lot of seniors have actually been to Pinecrest, so they come up and say, well, we've been there, we've had a nice meal, or beautiful community and so forth. And so we're enjoying everybody this morning. Pinecrest is an independent senior living community, and we have retirement housing for seniors. The monthly rent that they pay gets them 3 meals a day, breakfast, lunch, and dinner, cooked by a chef in the kitchen. activities and events every day, community bus transportation, utilities included, housekeeping. So pretty much a cruise ship that doesn't leave the dock is how I like to describe it.
Very good. And I understand that a lot of times that y'all will give us a free meal or something to give away to our seniors when we're having activities going on, and they come back and rave how the chef cooks.
We have a chef who loves what he does. Every time he has an opportunity to prepare meals for extra people or for extra, kind of additional events and occasions, he goes out of his way to do the best he can, and he goes over the top sometimes. And we have complimentary meals for seniors who want to come in, take a tour of the community, look and see what we have. And give an example, tomorrow we're having a pancake breakfast that benefits Catawba County Meals on Wheels. So we're always doing something to, get information out there and so forth.
Okay. Well, thanks again for coming, and we'll look forward to working with you throughout the year.
Well, I appreciate it. Thank you.
I'm here with Beth Slosher from the Catawba County Home Health. We're glad to have you here today, Beth. And you want to tell us a little bit about what you do?
Sure. Well, thank you first for having us. Catawba County Home Health provides skilled nursing and therapy services in the home. Anytime you've had a hospitalization or maybe a joint replacement and you don't have a family member that can get you out to get to doctor's appointments or therapy visits, then if your doctor orders it, we can provide those services in your home at no cost. It'll all be covered by your insurance provided it's written by your doctor. So I think it's a great service that we provide to the community. We are based in Catawba County, but we reach out to all 5 surrounding counties. And we actually have a nurse that lives in Alexander County, is very familiar with the area, and she provides services to citizens here in Alexander County. So we're very pleased to be here. We appreciate the opportunity and hope that you guys will consider using our services if you ever have a need for you or your family member.
Okay, and I understand you've got some great giveaways. I've had several people tell me about these wonderful walker baskets.
Yes, we have these great walker bags that you can actually attach to your walker, and it's got a zipper pocket where you can put your cell phone and your car keys and your wallet or your cosmetics if you need to touch up that makeup while you're out and about. It's a really great option to have, and in addition we've got some great pins and post-it notes and a couple of giveaway items. So thanks for having us. We've enjoyed being here today.
Well, thanks so much for coming.
Thank you.
Hi, this is Megan from Valley Nursing and Rehab. Megan, we're really glad to have you today. Y'all are always such a big help to us over here. Tell us a little bit about Valley.
All right, thanks, Jill. I'm here with Wanda Reese, one of our RNs. She's our wound care nurse, and she's doing blood sugar checks for us today. Valley Nursing Center is our local skilled nursing facility. We have a 183-bed facility, 40-bed short-term rehab unit, and a 49-bed subacute ventilator unit. So we have 2 specialty units, and then we provide skilled nursing care 24 hours a day, 7 days a week.
And I understand that she swears the blood sugar test doesn't hurt.
Oh, it's not bad. I let her test me. See, it can't be bad. Wanda's an expert at it.
Okay, well, we're going to let Wanda give a try to Beata here and see. You can tell us if it hurts.
Oh, all right.
Okay. Do you normally have trouble with your blood sugar?
No.
Well, that's good. Be a little stick. And her blood sugar is 151. So that's pretty good. Did you eat breakfast? Yeah. So it's probably, the normal is 80 to 100. So that's probably, yours is 151. So it's probably because you had breakfast.
And tell us, Beata, did that hurt?
No, didn't hurt.
Thanks so much. We're here with one of the Senior Center's seniors, Karma Yell. Karma, you want to tell us a little bit about the TOPS program?
Yes, TOPS stands for Take Off Pounds Sensibly, and we have a local group that meets at the Rescue Squad every Monday, and we're having an open house from 5:30 to 6:30 on this Monday.
And everyone, I take it, is invited. They don't have to be a senior, do they?
No.
Thanks so much for being here today, Karma.
Thank you.
Yes, here we have Kevin Richards he's a paramedic in Alexander County. Kevin, we're glad to have you today. Tell us a little bit about what you do.
Thank you, ma'am. I'm a paramedic here for Alexander County Emergency Services.
We provide 24-hour, 7 days a week emergency care for the sick and injured of Alexander County and the visitors as well. You can see some of our equipment we carry here. This here is a life pack. It provides diagnosis of cardiac rhythms. We carry miscellaneous drugs to whatever life threats that may be happening at the time. Today we're just doing random blood pressure checks, checking blood sugars also if they prefer. And we're giving out random brochures. We do recommend, though, if not already, have a med list provided at home. And what this does is expedites us getting off out of your home and into the hospital. When we're provided a med pack, it's kind of hard to know exactly what someone is taking, and it's nice to know if their medications might be counteracting with what we may be given, or what medications that they're on might be causing some of the illness that they may be having. So a med list is excellent to keep in your home. And if at all possible, write down what type of medical problems that you may have.
So that would be good to fill out and maybe post on the refrigerator
Absolutely,
or something.
absolutely. That's usually where we go is at the refrigerator to look for medications. And some medications is stored in the refrigerator, like your insulin. So it's great to have all this information filled out in case there is an emergency.
Okay, well, thanks so much for coming today,
Yes, ma'am.
Kevin.
Thank you.
Hi, I'm here with Carol Robinson from Catawba Valley Medical Center. I understand you're the Senior Services Representative. You want to tell us a bit about what you do?
Okay. What I do there is the Lifeline program, which is a personal emergency response system that helps people stay at home. We've got 2 buttons now, one that you press if you need help, and then another one that if you forget to press it or you're not able to press it, it will let us know if that person's had a fall. The other thing I do there is the seniority program. And the seniority program that we have is free, and it offers special discounts to different programs the hospital has and to eat there and at the gift shop and some other things like that. But it's free and welcome for anybody over 50.
Well, we're so glad to have you here, Carol, and hopefully we'll get some of the people enrolled in this program then.
Okay, thank you. Appreciate it.
We have Jennifer here from Alexander County Public Health. Jennifer, you want to tell us a little bit about what you're talking to the folks today about?
Sure. We're just telling everybody about the services that the health department provides. We have dental clinic, we have immunization clinics, we have pregnancy clinics, and then we also have Alexander County Home Health. We're checking blood pressures to give everybody an idea of where their baseline is and just letting them know that we are here to serve our county and our citizens.
And we're so appreciative you come every month and do our birthday lunch for us where you do the blood pressure checks for free every month. Thank you so much.
You're welcome. Thank you.
Hi, we're here with Sharon from the Division of Deaf and Heart and Hearing. You want to tell us a little bit about your services, Sharon?
Yes, we are the Division of Services for the Deaf and Hard of Hearing. We help individuals with hearing loss and speech impairments receive free equipment from the state. We help with hearing aids. We help with amplified telephones. We help with alerting devices. We also help with a weather radio if you have a hearing loss. So check us out. You can get in touch with us. We are out of Morganton, the Morganton Division of Services for the Deaf and Hard of Hearing, Morganton Regional Center, and you can contact the Senior Center to find out how to get in touch with us.
And then Sean comes here to do a lot of his services. So we really appreciate your help, Sean. Thank you.
And
you too. And here we have Eleanor from the YMCA. She's one of our special seniors. She comes to the Senior Center all the time. So Eleanor, we're glad to have you here representing the YMCA. Tell us a little bit about their services.
Well, at this particular time, we're having silver sneakers, we have gymnastics, we have, let's see, I can't even think right now, but we have got Child Watch, we have Zumba. We have a lot of different programs that would work for anybody that has problems, as well as going back and forth to the doctor, and the doctor gives them prescriptions to go and exercise. We have the treadmill, we have bicycles, we have, you name it, but our goal is, our mission is to help people reach their God-given potential in spirit, mind, and body.
Thank you so much, Eleanor. We're so glad to have you here today.
You're welcome.
And we're really lucky today to have the health department over here. They come every year and give the flu shots and a lot of other tests. I'm going to let you talk to one of our nurses that's then going to give us flu shot right today.
The health department was here today. We offered flu shots. We also did metabolic screenings. We did lipid panels, which is cholesterol, and also offered PSA testing for men. And this young man volunteered to get his shot today. All right, let's see this arm here, buddy. You just rest your arm right there for me.
Can I scream?
Nope, no screaming. All right, that's it.
Tell us, did it hurt?
Oh, it's terrible. No, nothing to it. Everybody should get it.
Barely felt it, right?
Much better than having the flu.
Yeah.